A husband and a wife by the name of Adrianix and Nona have gone to see a genetic counselor today, Alex Davis. They are concerned that their child, if they were to have one, would have sickle cell disease because they have two nieces and their nephews that have sickle cell disease, and Ona's sister has sickle cell disease. So they came to seek professional advice from a genetic counselor.
Alright, so here's what the pedigree of your family would look like using the information you would have told me. So we have her family over here, her mother, her father, her sister, and of course you. We have your family over here, your mother, your father, you and your brother, his two sons, and whoever he married. So we know that your sister has the defect along with your brother's two sons. And so by this, we can safely assume that he most likely had the trait. So we can mark him with the trait. And if he had the trait, since this is genetically passed on, we can assume that either your mother or your father had the trait. So we can assume that, worst case scenario, they both had the trait. And since your sister had the defect, we can safely assume that your mother and father both had the trait. Otherwise, she would not have had the defect. Now,
if this is true for this, would your brother's wife have the trait also?
yes, actually. Well, actually, there's two possible options she could have. She could either have the defect itself, which could make it a 50-50 chance of passing on the trait or the defect, or she could just have the trait. But either she has the defect or she has the trait. So I'm actually glad you brought that up. But now, at this point, until we do like a gene test on you two, we won't know for certain, but we can presume, using what we know of the defect, that you either have a 25, 50, 25% chance. So we'd have 25% chance that either your kids might get the defect, a 50% chance they would have the trait, and there's a 25% chance they would be completely fine with no trait at all. But we also don't know if you inherited the trait yourself, because again, if your parents had the trait, there's also that 25% chance that you may not. And in which case it becomes that 50-50 we were talking about earlier. Again, much better than, well, the 25-50-25, less chance of problems. At this point, unless you get yourself tested, you can only, you can decide to have kids or not. You won't know for certain if you have the trait or if you don't. But if you don't want to and you want to go ahead and have kids, I'd recommend you hope for the best, but prepare for the worst. After all, there's at least a 75% chance that if you both have the trait, they'll be perfectly fine. But again, there's always that 25% chance.
Alright, now it's our time to talk. After telling the couple the chances of their children getting sickle cell disease if they were to have one or multiple, the genetic counselor decides to tell them how it would affect the children's body. And so the blood cells, they have hemoglobin proteins in them that help carry oxygen throughout the bloodstream. As the blood cells pass through the lungs, hemoglobin both picks up oxygen and drops off carbon dioxide. This is called oxygenation. In the rest of the body, hemoglobin releases oxygen to the tissues and organs while picking up carbon dioxide. This is called deoxygenation. In people with sickle cell disease, hemoglobin clumps together during deoxygenation, causing the red blood cells to form to a hard crescent-like shape. This causes the red blood cells to stick to vessel walls, either slowing down blood flow or completely stopping it altogether, therefore causing a lack of oxygen in some areas. Due to the lack of blood flow and oxygen to a certain tissue, this tissue will start to swell and irritate the nearby nerves, causing severe pains. This is called the sickle cell crises, and they are caused by the buildup of sickle cell-shaped red blood cells that block blood supply to tissues in the body. This happens in smaller blood cells more often because it is more easily blocked off. A treatment to sickle cell crises are the hydrocarbamide medications. The hydrocarbamide medication causes the body to produce fetal hemoglobin. Although fetal hemoglobin is normally only present in unborn babies and young children, hydroxycarbamide can cause the body to produce more even as an older child, adolescent, or an adult. Fetal hemoglobin does not become sickle shaped, meaning that it can help to carry oxygen and nutrients and prevent sickle cell crises as well as complications such as acute chest syndrome. More symptoms could be severe headache, fevers over 100 degrees Fahrenheit, difficulty breathing, abdominal pain or bloating, and seizures. In a person with sickle cell disease, the bone marrow produces red blood cells that contain the hemoglobin S gene that produces the sickle cell disease symptoms and disorders. To prepare for bone marrow transplants, they use chemotherapy to weaken or destroy the patient's own bone marrow, stem cells, and infection fighting systems. This is done so the patient does not reject the new blood cells coming from the new bone marrow. The bone marrow is then replaced with blood-forming stem cells from a donor who does not have sickle cell disease. This can be a donor with normal hemoglobin or just a sickle cell trait.